exam. And I'll be recording this for those na medyo mahina ang internet connection. Again, let's talk about vasodilators and treatment of angina pectoris. So I believe you are familiar of what angina pectoris is. We are referring to chest pain here. So sa inyong laboratory, I have given the task to Ma'am Christine Medida to discuss the arrhythmia. If you have questions about arrhythmia, you can always ask me or you can ask Christine for that. So let's talk about ischemic heart disease before we'll move on with angina mismo. Pag makabatigan ni mo class og ischemic na word, ischemic heart disease, we are referring to the reduction of the blood supply in the heart mismo, okay? In the heart mismo, meaning there is lack of oxygen in the heart. So other terms that we use to refer to ischemic heart disease are the following. We can use atherosclerotic disease of the coronary arteries, or we simply call it coronary artery disease. So the problem here are the arteries of the heart, because even though the heart has the responsibility to pump blood and supply oxygen all throughout the body, but before it can work efficiently, kailangan pud niya og sariling oxygen. And dito na siya moagi class, ang blood padulong sa heart sa coronary arteries. So if we have problems with the arteries of the heart, merong blockade, there will be reduction in the blood supply sa heart mismo. And what do you mean by atherosclerosis? It's a condition wherein there is the deposition of plaque in the arteries. So if these plaques are located in the coronary arteries, that's the time we call it coronary artery disease. So we have here the example. This one is the normal artery wherein there is efficient blood flow. Well, this one is an artery narrowed by a plaque. So there is deposition of cholesterol na plaque in the artery, narrowing the pathway of the blood to flow. So ano na siya, most of the time it's cholesterol, pero dili lang na siya cholesterol ha, it's actually a combination of cholesterol and then with the action of the calcium also, and then other substances pa, and then ang mahitabo mugahi na siya and ma-deposit siya sa blood vessel. So mo na ni siya karon ang sinugdan sa mga heart problems. Ischemic heart disease, heart failure, or it can even lead to hypertension because of the fact that there is narrowing of the arteries. Okay, so again, we call it atherosclerosis. To some cases, this is actually genetics. Genetic ang iyahang isa ka factor ani. If it is in your bloodline, in your genes, sa inyuhang family, most of the time kanang ma-pass on siya from generation to generation na ano gid sila kanang murag plaque former, and mostly sa heart jud. Pareha sa amuang family, sa side sa ako ang papa, most of them na mga uncle, mga auntie, even akong father, right, o ang ihang mga igsuon, ihang mga pinsan, they have heart problems and they have enlarged heart due to this one. They have arteries narrowed by a plaque. Paano mabalaan if plaque former? Actually, you cannot really see this one until nga dili sila magkaroon og like signs and symptoms of a disease, especially the heart disease. So murag dili gyud siya basta-basta mabalaan. But since we know that this can be genetics, so a person pwede niya ma-expect nga magkaroon pud siya ing ana nga sakit because of the genetics na factor. So ang kailangan ani is actually to live a healthy lifestyle, proper na diet and exercise para lang yun ma-help ang heart na dili siya basta-basta magkaroon og plaque. Dili basta-basta magkaroon og atherosclerotic plaque. So mao na lang na ang buhaton kapag naa na siya sa inyuhang linya. Paano ilahang diagnostic test, ana? Actually, you can start with the lipid profiling. So, di ba, we have the lipid test sa mga hospitals or sa mga laboratory wherein there will be lipid lipid profiling. When you say lipid profiling, dili lang siya cholesterol, apil ang triglycerides, and then the different types of cholesterol like the LDL and the HDL. The HDL is the good cholesterol. And mo na siya ang gusto nato nga daghan sa atong body ang kanang good cholesterol. So we still need cholesterol ha, dili pwede nga wala pud tay cholesterol sa atong body. Kailangan lang gid nato ang good cholesterol class kasi gitawag na siya good kay manglimpyo man gud na siya sa atong body so that we will not have atherosclerotic plaques. Pero atong problema kung bad cholesterol ang daghan, mga LDL, call that LDL and the VLDL, ang meaning ana kay low density lipoprotein. Ang HDL is high density lipoprotein. Gitawag na siya high density lipoprotein kay mas daghan iyang protein kaysa sa lipids. Pero ang low density lipoprotein and the very low density lipoprotein VLDL, mao na sila atong ginatawag og bad cholesterol and mao na siya ang nagadeposit class sa ato ang mga arteries. Okay? So that's one of the tests that we do. Pwede ninyo na siya himuon, pwede ninyo na isuggest sa inyong family members if you have like nabalaan ninyo sa inyong linya nga sa inyong genes nga murag naagid siya sa inyong family, pwede mo magpa-annual lipid profiling. Medyo mahal-mahal lang na siya nga test kasi tanan klaseng lipids gina test including the fats and oils, triglycerides. The fats and oils are under triglycerides. So iba pa ang cholesterol. Okay? That's the first one. And then if there is signs and symptoms of a heart problem already because naapektuhan na kasi nag-narrow na gyud ang arteries, so the patient will experience the signs and symptoms na of a heart condition. That's the time we have the ECG, the electrocardiogram, and then the 2D echo. Pwede din yan siya movie na the 2D echo. Are you familiar with 2D echo? Okay. The 2D echo is where you listen also to the kadaganing heartbeat. Kaya nagapahinga naman akong papa sa una. Mabalan jud. Ang tama jud nga sound sa heart is labdab. Ana jud na siya. Pero if my heart condition ang patient class, mulahi iyang tingog murag na nagdagan nga kabayo. So, una siya ang tingog sa sa heart sa ako ang papa dati. Murag na nagadagan nga kabayo. Kasi dugdug. Labdab man. Ito na belly. Labdab man gano'n siya. So, pwede po na siya to the echo. And napay uban test like the troponin test. Pag mutaas manggod na siya, meaning you also have problem with your heart muscles. So daghan ng test nga pwede himuon. Pero sa ECG pa lang plus makita naman na siya. Okay? Pero sa ECG, it's more of the arrhythmia. Pero anyway, remember that if you have heart problem, most of the time you'll have tachycardia. Pag nakay heart failure, you'll have tachycardia. So sa ECG pa lang makita na daan that there is something wrong sa heart. It's just that we have to locate kung asa dapit ang guba nga arteries. And pag dili naman gud na siya kaya sa mga tambal, mao na siya ang time nga gina-surgery. Like we have the angioplasty, kanang mag-insert gani og balloon sa arteries, mag-insert og balloon diri sa arteries class para pag burot ana sa balloon kay mudako pud ang agianan sa blood. Pero ginaano pa na siya, assess pa ang patient if pwede pa ba siya angioplasty kasi if grabe na gid ang problem with the coronary artery, pwede na siya bypass, gina-bypass na siya, meaning iliko na ang agianan sa you call that sa blood kay tungod may problem ani nga artery, putulon to siya ipaagi sa lahi nga arteries ang blood. That's what we call the bypass. So lahi na siya sa angioplasty. Okay, question so far about this? Anyone? So let's talk about angina pectoris. This is what you call chest pain. There is sudden, mukalit lang na siya ha, sudden, severe, and crushing chest pain na mag-radiate siya to the neck, the jaw, the back, sa imuhang likod, and sa imuhang left arms. So mauna siya ang ma-feel sa patient nga naay angina pectoris. Sakit kaayo. There is chest pain. So naingon ako kagaina tong sa video nga gipakita na there is also other people na experience of chest pain murag ginatusok ilahang dughan. Pero most of those cases kay ang ilahang diagnosis kay heartburn. There is acid reflux. There is acid reflux mo na siya feeling nila sakit ang ilahang heart. Kasi iba jud class ang pain kapag it's because of the heart. Okay? Sakit kina siya muna nga magunit yun na sila sa ilang diri. Kita mo tao nga naga-heart attack, magunit yun na sila diri. Murag ginaduot nila. Okay? Sa grabe ka sakit. Okay? And the other symptoms aside from the chest pain, we have dyspnea. There will be difficulty in breathing, indigestion, nausea, vomiting, or even diaphoresis. Diaphoresis refers to excessive sweating. So there will be sweating during the chest pain. Okay, now what is the cause now of angina pectoris? So ang ato ang body class, mura po na siya economics. There is supply, there is demand. So in this case, sa angina pectoris, there will be imbalance between the oxygen requirement of the heart and the oxygen supplied to it via the coronary vessels. Again, the problem with angina pectoris is that there is lack of supply of oxygen to the heart mismo. That is now the difference between heart failure and angina pectoris. Heart failure class, the heart fails to deliver enough blood supply to the whole body. Again, sa tibuok lawas ha, sa tibuok lawas when you say heart failure. But when you say angina pectoris, there is chest pain because there is lack of supply of oxygen to the heart mismo. And that will be supplied actually by the coronary vessels or the coronary arteries. Again, the problem with our coronary arteries is that there will be atherosclerotic plaque na nagdeposit. Okay? So we have types of angina. We have the classic or the typical angina, or we call that stable angina or effort-induced angina. Okay? Stable angina or classic angina, pareho lang na sila. And then from the name itself, effort-induced angina, this is where the patient will experience chest pain if there is excessive physical activity. So mo na gitawag siya effort-induced angina. Now another type is what we call unstable angina. And then we also have Prinzmetal. Other name for Prinzmetal angina is variant. Pwede po siya vasospastic or rest angina. And then lastly, we have the acute coronary syndrome. So again, sila tanan mo ni ato ang angina ha. Class studying heart disease, magdaghan kayo mo dapat isipon. Kasi aside from that, diba, we have the arrhythmia. And katong arrhythmia class, napod tayo klase-klaseng types sa arrhythmia that you have to know also. So in this case, lahi pod ni ang types sa angina. So let's talk about classic angina first. Again, other name for classic angina, typical, stable, or effort-induced angina. So ano yung experience ng patient with classic angina? There will be short-lasting burning, heavy or squeezing feeling in the chest. Definitely this is painful. Murag ginaduso imuhang dughan. Then there will be extreme fatigue, nausea, or diaphoresis. Now, since this one is an effort-induced angina, the first thing that you need to do to the patient is to let him or her rest. Kailangan siya mag-rest kasi tungod nga grabe iyang physical activity, ang problema dili makaapas ang heart sa supply nga kailangan niya. Kaya pag, di ba, pag exercise ta, paspas ang atuang heartbeat. Grabe ang trabaho sa atuang heart. Kailangan niya mag-deliver of oxygen sa tibok lawas. O kailangan po niya syempre mag-deliver of oxygen sa iyahang heart muscles mismo para magtrabaho pa siya efficiently. So kung mag-ingana na naay atherosclerotic plaque, makulangan yun, dili makaapas ang heart sa pag-supply og oxygen. So kailangan lang sa patient ani og rest, or for some cases we use the nitroglycerin. So naatay patch for that, ginabutang sa ilahang dughan, transdermal patch. Though sa skin lang siya ginabutang, pero you know that drug delivery system, we can still have the drug na ma-absorb sa bloodstream even if sa skin lang siya ibutang. So mani siya ang gamit class ni nitroglycerin. Now, what is the cause of classic angina? There is reduction of coronary perfusion due to a fixed obstruction of a coronary artery by atherosclerosis. Meaning, ang cause gihapon is atherosclerotic plaque, cholesterol plaque deposited in the arteries of the heart. And because of that obstruction, there will be lesser amount of blood that reaches the heart muscle. So thus the patient will experience chest pain. So that is for classic angina. Now we also have unstable angina. Again, unstable angina. So what are the symptoms of this one? We have here chest pain with increased frequency, duration, and intensity and can be precipitated by less effort. So even if the patient is not doing a strenuous physical activity, dili siya nag-exercise, nag-rest lang siya, o naghugas lang siya og plato, pero the patient may experience also chest pain. And it's actually more painful compared to the stable angina, and it lasts longer. The duration is longer, the frequency is much higher, meaning magsigi sila og experience og chest pain. Now, what are the treatment for unstable angina? Syempre, since this is not associated with physical activity, rest is not an option here. We cannot relieve unstable angina by rest. Thus, unstable angina always requires hospitalization and more aggressive therapy. Again, most of the time, this requires hospitalization because remember that chest pain is longer when it comes to duration and there is much higher frequency. Magsigig, balik-balik ang chest pain in a day. So again, this always requires hospitalization and requires more aggressive na treatment. So later sa atuang discussion, I will discuss the drugs used for angina. Okay, questions so far about the two types of angina? Nasabtan ba to? Walay pangutana. Sige, so let's move on sa third one. We have here the Prinzmetal Angina. So si Prinzmetal Angina or vasospastic. When you say vasospastic, there is spasm sa blood vessel. Ano sa meaning sa spasm class? Pero may mga nato na mabatian. Even sa tiyan, di ba natay ginatawag spasm. Nagay tay drug nga anti-spasmodic like the Buscopan. Pero sa tiyan to siya ha. So, ano sa meaning sa spasm class? Sa meaning na? Anyone? Yun naman magbuskupan. Yun naman magbuskupan. Okay, yeah, moving na. There is involuntary muscular contraction, and that contraction actually has longer duration, mura siya dili mo relax ba mo nasakit imong tiyan. Let's not talk about Prinzmetal Angina first. Dito sa atas sa spasm sa tiyan. Kana magsakit gani imuhang tiyan, ya mo inom kag buskupan. Ya nag muscle spasm ka, imuhang mga muscles ana sa gastrointestinal tract is contracting. And ang problema kay dili siya mo relax, mo na nga painful. That is what you call spasm or cramps. Yeah. Pwede po nato na siya gamiton ng word. So mo na nga pag ingana gani inyong na-feel sa inyong tiyan, pwede mo inom og antispasmodic to release the spasm, to relieve the involuntary muscular contraction that causes the pain. Now, this time, for the Prinzmetal Angina, there is spasm, localized na mga portions sa blood vessels sa heart na magkaroon og involuntary contraction. And since nag-contract na sila pag maayo, there will be obstruction to the blood flow. So, kay naamay obstruction sa blood flow, makulang ang blood supply, ang oxygen supply, mo na nga mag-experience gihapon ang patient og chest pain. Now, what is the reason of this localized spasm? This is actually caused gihapon by atheroma or atherosclerotic plaque. So, parehas lang gihapon. Atherosclerotic plaque lang gihapon ang cause ani. Kaya lang kani siya na ay muscular contraction nga involved. Kani kay there is really an obstruction, that is why nga siguro grabe na ang obstruction ani mo na magsigig ulit-ulit ang chest pain and then longer ang duration. Kaning sa classic angina there is obstruction but the heart can still supply blood sa iyahang heart muscles and matrigger lang siya kapag more than the ordinary physical activity na. Okay, now what are the treatment for Prinzmetal Angina? We have vasodilators. Coronary vasodilators like NTG. NTG is nitroglycerin, and CCBs we have calcium channel blockers. Okay, ano siya ang treatment for our Prinzmetal Angina. You can ask question if namoy wala na sabtan. Now for the next one, we have the Coronary Artery Syndrome. Again, Coronary Artery Syndrome. So this is an emergency that results from rupture of an atherosclerotic plaque and partial or complete thrombosis of a coronary artery. So that is what actually what we saw from the video a while ago. There is actually coronary artery syndrome and there is a rupture. Magkaroon gani og kanang injury or what you call this, masamad ang atherosclerotic plaque due to reasons like the patient has physical activities like katong playing something gidula, and then due to the rupture there will be partial or complete thrombosis, blood clotting. Okay, and for most of the cases, coronary artery syndrome may lead to myocardial infarction. Kung sa layman's term pa, heart attack. So again, mao na gid ni atong nakita kagaina sa video. Mag-lead siya into myocardial infarction or MI. Questions about the different types of angina? Asa dapit din ha ang wala na sabtan kaya atong usabon. Atong usabon class tabang. Okay, wala. So let's talk about the pathophysiology of angina. We have here determinants of myocardial oxygen demand. Paano nato ma-determine kung unsa kataas ang demand ni heart mismo for oxygen? So we have here the first one, the wall stress, and that includes intraventricular pressure, ang pressure mismo sa heart, ventricular radius or volume sa ventricle sa heart, and the wall thickness. So kung unsa kadako ang muscle sa heart, that will also determine the oxygen demand. Nakuha? Siyempre kung dako imo ang heart, daghan siya og cells, daghan pud na siya og demand sa oxygen. And then heart rate will also determine the demand. If you have increased heart rate, it means also that you also have increased demand for oxygen. To keep up with the rate sa heart, kailangan man jud na niya og oxygen para magtrabaho siya. The same thing with contractility. So again, these are all determinants of myocardial oxygen demand. Now, how about the determinants of coronary blood flow and myocardial oxygen supply? Paano po nato ma-determine kung unsa kadaghan ang supply sa blood padulong sa heart? Now, we have the first one, this is directly related to the perfusion pressure, or that is what we call the aortic diastolic pressure and the duration of the diastole. So, di ba, the diastole is when the heart relaxes so that it can fill in the blood. I mean, ang blood gas mag-fill in dito sa heart. So, kung unsa ka dugay ang ato ang diastole, mao pud to ang kadaghanon sa blood na makasulod sa heart. And that will really determine how much blood will be supplied in the heart mismo, heart muscles. But this is inversely proportional to coronary vascular bed resistance. So even if there is a lot of blood gas that enters your heart, but if your blood vessels are resistant, mag-resist sila sa pagsulod sa blood, mugamay jud na ang ato ang blood supply. Mo na nga inversely proportional siya kapag sa coronary vascular bed resistance, especially if there is an atherosclerotic plaque, kay mo resist man gyud na siya sa blood flow. Kay katong plaque nga na deposit, obstruction naman to siya. Okay? Questions? Wala? Pangutan na mo haog na mo'y wala na sabtan niya, basig sige ra kog istorya dinhi, tas naglupad di ay inyuhang mga utok. Okay? Let's have drug action in angina. So, unsa ba ang mga drugs nga to ang ginagamit for angina and para asa sila? So, ang first one here, decrease myocardial oxygen requirement. Ang ato ang mga drugs na ginagamit for angina is either para sa demand or para sa supply. So, ang first one din maghatag tambal for our patients na naay angina to decrease the demand. Ipagamay nato ang demand so that the heart can keep up with the supply. Then how can we decrease the demand of oxygen? Syempre, ang ato ang hilabtan, ang mga determinants sa oxygen demand sama sa heart rate, ventricular volume, the blood pressure, and contractility. Example sa heart rate, pag ipahinay nato ang heart rate class, it means that mubaba pud ang iyahang demand. So kung ibaba ang demand, the supply can keep up with it and the patient may not experience chest pain. So mo na siya ang first na kanang goal nato for the treatment. So what are these drugs? We have organic nitrates. And in here, our first drug, our prototype drug is the nitroglycerin. Okay? But the problem with nitroglycerin is that it has a very low oral bioavailability because of the enzyme produced by the liver called nitrate reductase. So again, this is the enzyme produced by the liver that will metabolize most of the nitroglycerin. So mo to siya ko ingon kagainan na nitroglycerin is mostly given as transdermal patch. Iyahang drug delivery system kay transdermal patch. I hope nakuha ninyo na siya. That is the reason. It has a very low oral bioavailability. Ang portion sa drug nga nakaabot sa bloodstream is very low. Aside from the nitroglycerin class, we also have other organic nitrates like the isosorbide mononitrate, or usahay man good, wala kung sa pharmacy na mo mag-work, wala man good na siya usahay ginasulat sa doktor nga buo, so gina-abbreviate na niya as ISMN. Pag makitan gani ninyo ni siya na reseta, puhon, pag maka-work mo sa pharmacy, ISMN refers to isosorbide mononitrate. Examples of brands available in the market, we have the ISMO and the Imdur. But actually, isosorbide mononitrate is an active metabolite of the dinitrite. So naputay dinitrite, active metabolite si ISMN pero naanatay existing drug na ISMN na diretso. And ginagamit si ISMN as a maintenance drug for the prevention of chest pain. So ginagamit ni nila class, ginainom ni nila adlaw-adlaw para there will be vasodilation and that the blood can supply efficiently oxygen sa iyahang heart muscles. Okay? And then we have the ISBN. So again, if this is the ISMN, this one naman is the ISBN. Or this is what we call the isosorbide dinitrate. Ang pinaka well-known na brand sa market is Isordil. So ginagamit ni siya, very similar to nitroglycerin, but it has a slightly longer duration of action. So ginagamit ni siya class si ISBN during the attack. Just like the nitroglycerin, di ba? Pag mag-chest pain, pwede ka maghatag og nitroglycerin. Pwede po na siya ibutang the whole day sa lawas sa person para to prevent attack also for the whole day. Ang Isordil naman, hindi siya transdermal patch. Instead, si Isordil, meron ito siyang sublingual na dosage form. So kanang gamay kaayo nga tablet na pink, syempre sublingual, sa ilalom sa dila. So during the chest pain also ginabutang na siya to dilate the blood vessels. So si ISM, though na tablet gihapon hang orally given, dili siya sublingual. Si ISDN, si ISMN is a tablet mismo nga ginainom, dili siya sublingual. Okay? So, mani sila atong mga organic nitrates. I hope nasabtan to siya. Ako yung panghatagan itong ni Agi na ISBN. I still have it now. Wala pa na ko siya nahatag kay Ma'am Nelba. ISBN. So, basta na yung mga tambal na mga excess. Like, napanghatag ko lang na siya. I'm not allowed to, what you call that? Dili ko allowed na ibaligyan siya kasi I don't have the LTO. Di ka pwede mamaligyag tambal. Bisag pharmacist ka class, di ka pwede mamaligyag tambal ha kung wala kay license to operate from the FDA. Okay? Next, we have the amyl nitrite. Again, we call it the amyl nitrite. This is still actually part of the organic nitrates, but this one is a liquid, a highly volatile one, and ginagamit siya once given as inhalational drug. But take note, this one is obsolete now, meaning wala na siya ginagamit for angina due to its unpleasant odor. Remember, this is inhalational pero lain kay siya amoy, and very short duration of action. So we only have the three now: nitroglycerin, ISMN, and ISDN. Amyl nitrate is now obsolete. Okay, now let's talk about the mechanism of action of our nitrovasodilator. So this is true for NTG, ISBN, and ISMN. So we have here nitrates become denitrated by glutathione S transferase. Pag ato siyang inumon inside our body or ato siyang ihatag sa as patch or as sublingual, ma-metabolize siya syempre sa atong body, matanggal ang nitrate using this enzyme, glutathione S transferase, and ma-release si nitric oxide. So remember, di ba, si nitric oxide is an endogenous substance in the body that is actually a vasodilator. So kung i-summarize nato class, ang mechanism of action ni Nitrovasodilators, that is actually the release of nitric oxide. So, mao gina siya. Pero kung gusto ta makabalo sa step-by-step gyud niya nga mechanism of action, after the release of the nitric oxide, this substance here will activate the GC or the guanylate cyclase. So, this is an enzyme that is used to convert GTP to CGMP. Do not forget ha, CGMP sa manof is different sa CGMP sa PCOL. CGMP sa manof kay current good manufacturing practice. Ang sa CGMP sa PCOL class, it's cyclic guanosine monophosphate. So asa na siya gikan si CGMP? Gikan na siya kay GTP or the guanosine triphosphate. Ma-convert lang na siya kung naan na si guanylate cyclase na enzyme. Sorry, na-distract ko sa chat sa someone. Kasi pangita ni Ma'am Eroy. Asa mo si Ma'am Eroy? Sa ako man pangitaon. Anyway, now, if there is CGMP, ma-activate si CGMP-dependent protein kinase. This is another enzyme, the protein kinase here. And take note that this is CGMP-dependent. Ma-activate lang nga siya pag naana kay CGMP. Now, what happens now if this protein kinase is activated? This will result in the phosphorylation of several proteins that reduce intracellular calcium, causing smooth muscle relaxation. So magkaroon og relaxation sa smooth muscles, especially the blood vessels. And remember, pag mag-relax na siya, it means there will be dilation. Mo-relax man siya. Pag relax na niya, ang agianan class sa blood mudako. Muna siya gitawag siya dilation. And thus, nitrates are considered vasodilators. Okay? Questions about the mechanism of action of our vasodilators? I mean the nitrovasodilators? Wala, kasi nabutan eh. Let's have a 5-minute recording. So let's talk about the clinical application of our nitrovasodilators. Syempre, these are used for angina. They have sublingual form for acute episodes. So during the attack, during the time that the patient experiences chest pain, we can use the sublingual form for angina. And then we have the oral and transdermal forms for prophylaxis. So that every day, I mean the whole day, the chest pain will be prevented. And then the intravenous class na NTGs or the nitrovasodilators natin are used for acute coronary syndrome. So during the time that there is rupture of the atherosclerotic plaque that may lead to myocardial infarction or heart attack, syempre, dili na nato ulaton na mag-oral pa, mag-transdermal pa. Syempre, IV yun ang ginagamit, intravenous. Now, what are the problems with with the adverse effects or the toxicity of these nitrovasodilators? We have here the first one, orthostatic hypotension. So there will really be hypotension class because of the vasodilation. Diba remember, pag mo-dilate ang blood vessels, there will be decrease in the blood pressure and it may lead to orthostatic hypotension. And because of the decrease in the blood pressure, there will be tachycardia. That's the body's response always kapag mubaba gani ang blood pressure na to class. Ano gina siya? Response gina siya sa body na mag-release of either norepinephrine or epinephrine para ipapaspas ang heart rate. Okay, to keep track with the decrease in the blood pressure. Now, this one is a board exam question. We have here the throbbing headache. So, katong nag-discuss ta og headache, di ba, migraine, cluster headache. Remember na it may be due to the dilation of the blood vessels sa ulo. Na pag maghatag ta og nitrovasodilators, it's not for the heart only. So always remember that that pag nag-inom ta og tambal, all parts of our body have the drug supply. So apil ang blood vessels sa brain, sa ulo, na mag-dilate. Thus, the patient may experience headache. Throbbing headache, nagapitik-pitik na headache. Naka-experience man siguro taana, tanan. And another problem with our nitrovasodilators is the so-called tolerance. Okay, again, tolerance or there is tachyphylaxis na mga isolated smooth muscle that may develop complete tolerance sa drug. So, kadugayan class, dili na siya mo epekto, dili na mag-dilate ang uban ng mga blood vessels, wala na yung relaxation nga mahitabo. That is due to the insensitivity na sa mga receptors sa body against sa drug. So, manatong problema with the nitrovasodilators. And then, ano sila ginatawag og Monday disease. This is common to the workers involved in the production of nitrovasodilators. So nganong Monday disease man ilahang tawag? Kasi ang mga workers nga involved in the production of these drugs kay, di ba, like Monday to Friday naa sila'y trabaho. Nag-produce sila og nitrovasodilators and they are exposed to the drug. Bisan pag wala sila ni inom class, you will be exposed to the chemical. Remember, we have the gaseous state of these chemicals. So ma-inhale nila from Mondays to Fridays. They have this drug supply in their body. Na pag-abot sa Sabado ug Domingo, most of them wala man dyan na siya work. Kasi most of the time the work is Monday to Friday, usahay Monday to Saturday, pero at sa Sunday, most of the time, wala gina siya trabaho. Tapos pagkahuman, pag mubalik na sila work sa Monday, the patient will experience headache. That is why they call it Monday disease kasi most of the workers involved in the production kay naay sakit pagka-Lunes. And ang sakit nila is the throbbing headache. That is due to the kanabitawng sa Sabado ug Domingo wala sila drug supply. So ang ilahang body mag-cleanse sa drug nga nakuha nila from Mondays to Fridays. But the problem is during Monday nagkaroon na pud sila kalit og exposure to the drug. And that will lead to Monday disease. Sakit ilahang ulo. Again, that is common to the workers involved in the production of nitrovasodilators. Monday disease. Sama sa ato karon natin. Nanay Monday disease, murag nagpahuway ta Sabado Domingo, tapos pagkahuman balik na sa eskwela sa Monday, ang mga estudyante na ay Monday disease. Namoy nagafatigue mo imbes Monday na hinuon nakapahuway Sabado Domingo, kung walay klase Sabado Domingo nakapahuway, pagabot og Monday gikapoy mga estudyante dili man unta worker sa nitrovasodilator na production pero naay Monday disease. Okay, sa bukay. So makarelate mo sa sa nitrovasodilators na production, sudden exposure na pud sa klase after the rest sa mukay. But I think you had your class last Saturday, right, with Sir Kenny, tama ba? May headache sad mo sa mukay.
Yes, ma'am.
Ano ginahimo ninyo? I wasn't able to actually we were invited pero for the two Saturdays I wasn't able to join because I have my class number 1 last Saturday. I have my class sa Masteral. Nagtudlo magugko sa Masteral sa UIC. So na siya pamugas-mugas para na ako ikapalit sa ako ang mga luho sa sa akong mga pag fangirl. So agwanta tag tudloan ni sa masters para na ako ikapalit. Tapos, last Saturday, I have my class sa PhD. So, I have no time to join sa lecture ni Sir Ken. Gusto ko actually mo appeal, pero I cannot. So, this Saturday also, I'll have my class na naman sa Masters sa UIC. Okay? Any questions so far? We have other nitrovasodilators. Let me check. I forgot. Dugay na magugkay ko wala nakasulod o community pharmacy. The Coronary. I am very much familiar with the brand. Dati, itong nag-work ako sa Rose Pharmacy. Karon nakalimot na ko. Coronary. The most common one in the market, the Coran. Ano siya tong drug nga heart iyahang shape. Yan. Heart. The Coran. Ano siya iyahang brand name sa market ni Coronary. This is a nitrovasodilator gihapon. Again, heart jud ang shape sa iyahang tablet na ginabaligya sa market. This is a nicotinamide nitrate ester na naagihapoy vasodilating properties in normal coronary arteries but more complex effects if the patient has angina. So mas efficient kung naay angina ang patient, pero it can also dilate the normal blood vessels. I think diri na lang sa kumag-end. We will discuss the succeeding na mga parts maybe next week. Let me just check the first schedule. So ang next nato nga i-discuss will be the calcium channel blockers, pero I will not really dig deeper with this one kasi we are done with CCBs, and then after the CCBs we will get back again with the beta blockers, and I'll concentrate with the newer anti-anginal drugs afterwards. Okay? So dili na kayo ko mag-discuss pag maayo with that. Ma'am, matuloy po yung animal handling. Yeah, magsugod na mo og animal handling sa midterm. Let me stop the recording.